Hi, I'm Dr. Greg Castello, board-certified family practice, and a little bit late in the season, but we're going to talk about influenza and the influenza vaccine because it's a very interesting topic. So influenza, or the flu, is a specific set of respiratory virus infections. People generally use the flu to mean a bunch of different things, from throwing up and diarrhea to a bad cold to influenza, but influenza very specifically is one group of viruses called influenza, and the flu shot very specifically is for the flu. So when people come in and say, I had a flu shot and now I'm throwing up and having diarrhea, the flu shot didn't work. It's because it's not the right flu, it's not influenza. So every year we have flu season. Usually starts very late in the winter time. Usually February and March is a typical start of influenza. The 2012-13 season, we had a very early influenza, started in mid-December, and the timing was actually pretty good because it started ramping up about the time kids got off for Christmas break, and everybody went home for 2 or 3 weeks, and that was a good way to end the flu season. And we didn't have much flu until a little bit of late influenza B in March and April. So we get the flu shot. There's 3 different strains of flu in the flu shot. There's multiple strains of flu, which is why we have to get a flu shot every year, because there's different strains that show up each year, and last year's flu shot doesn't necessarily protect you from this year's flu. You can get the flu more than once, again, because there's more than one different flu strain. So a typical influenza flu shot has 2 influenza A's, an H1N1. The last 3 years it's been the swine flu that we had starting in 2009, so that's now part of the regular flu shot. That's H1N1. There's an H3N2, which is another group of influenza viruses, and there's one influenza B virus, which is in the flu shot as well. So 2 A's and 1 B's, and it varies year to year. They actually go down to the southern hemisphere, who has their flu season opposite of us, and they isolate different flu viruses in the southern hemisphere and make a prediction as to what influenza strains are going to be popular in the northern hemisphere, because it takes them a good 6 months to make the flu vaccine. So they actually start production in January and February, make a decision, and then by the time flu season comes, they're married to what strains are in the flu. So sometimes we have a little bit different influenza that's in the flu shot, and it's too late to change or make a new flu vaccine. It's always a good bet to get a flu shot anyways, because there is some cross protectivity with it. So get a flu shot. The other thing I wanted to point out is that people that complain, I don't get the flu shot because it gets me the flu, it's absolutely impossible. The flu shot is dead virus. They basically take the flu virus, chop it up in a blender, and give it to you in little pieces. So as a total, you make antibodies against the flu virus, but none of the pieces can actually cause influenza. What's interesting is that you can actually have an immune response. So you get the flu shot, your body has never seen that particular infection, so you make antibodies against the portions of the flu vaccine, and part of an antibody response is low-grade fever, some body ache. So when you get sick, half of your infection or symptoms are caused by the infection, the other half is caused by your immune response fighting the infection. So the more unique the infection is, the more symptoms you have. So ironically, the person who complains the most about being achy and flu-like after a flu shot is the one who needed it the most, because they had no idea what was in the body in the flu shot. They made a vigorous immune response, and they got the best response to it. The only other explanation as to why you get the flu with the flu shot is if you were sitting in a doctor's office and somebody's coughing on you and actually gives you the flu while you're waiting for your flu shot. But you absolutely, positively do not get the flu from the flu shot. A sub-variant to this is the nasal flu mist, and that's actually weakened live flu virus. So we give you a very mild case of the flu with a nose spray, and you can get a slight case of the flu with the nose spray, but not with the vaccine. The flu is potentially deadly. Those who have never had the flu don't know how sick you can get, but it's a miserable experience. Anywhere from 3 to about 50,000 people a year die in the United States from influenza. Most of those people are older adults, but there are some healthy young adults that occasionally get the flu and die. It's thought to be more of an immune response than an actual infection, but you can die at any age from influenza. It's very easy to get the flu shot. You want to get it probably 4 or 6 6 months before the start of flu season because you need to have time to make adequate antibodies against it. The major chains, I won't say who, were offering flu shot very early as August of last year as a more of a marketing ploy. So we don't want to give you a flu shot in August because come next February, it's now been 6 or 7 months since you've had the flu shot and your immunity may be wearing off a little bit. The reason why they gave the flu shot early was because they had it available. So the flu shot didn't change from last year. It was available earlier than it normally is. They figured if I give you the flu shot in August, then by the time your doctor actually recommends it in October or November, you've already had it at I'm not going to say who. You've already had it at the drugstore, and they have you, and they get their $12 out of you. So don't get the flu shot in August. Get it October, November when your doctor recommends it, as always. We do have treatment for influenza called Tamiflu and something called Relenza, which is an inhaled medication. And those are very effective against the flu, but you want to get on them within 24 hours of the onset of your symptoms. The flu virus multiplies in your lungs, and by the time you're 48 hours into flu, your body is overwhelmed with influenza, and taking the medicine does not help. So if I give you the flu medicine at 48 hours of the onset of symptoms, it actually only cuts 12 hours off of the entire disease. So instead of being a 7-day infection at 6.5 days, it's not actually worth taking the medication at that point. But if you have the flu or think you have the flu and you get to the doctor early enough and they put you on the flu medication within 24 hours, then there's a good chance you're going to cut the flu down to about half of the course. So maybe a 2 or 3 day illness as opposed to a 6 or 7 day illness. Also greatly decreases the chances of you getting complications like pneumonia from the flu. It decreases the extent of your contagiousness and less likely that you get it to other people. So get the flu shot every year, even if you're healthy. If you think you have the flu, high fever, body aches, and cough, get to your doctor within 24 hours. Ask them about the Tamiflu medication if it's appropriate for you. Stay away from other people as best you can in flu season and be healthy. Dr. Greg Castello, thanks.